There are two common forms of diabetes. Nearly 10% of diabetes cases are type 1. People tend to develop this form before their 40th birthday. Although type 1 is dangerous to the body, it isn't as harmful as type 2. Approximately 90% of diabetes cases are type 2. This form typically develops as people get older and become physically inactive. And data collected from the Center for Disease Control shows new cases are more prominent in the Hispanic and Black communities. Abel Bravo is a hardworking husband and father of 5 children in the Chicago area. He's a Spanish-speaking immigrant who came from Mexico in 1990. 8 years ago, Abel was diagnosed with type 2 diabetes. I did not know. I went to the hospital and they left me there. They told me my sugar levels were very high and that my blood pressure was very high. As Abel's condition worsened, he had to get the toes on his right foot amputated. It all began with my big toe. There was something I tended to pick at, and it got infected. Diabetes patients are treated through insulin injections or tablets. Failure to properly treat diabetes can create complications like the loss of limbs, hypertension, or heart problems. Doctors recommend that patients maintain a healthier lifestyle by exercising and eating fresh foods daily.
What we want people to understand is that if you take some very small steps and some very reasonable steps, you can improve your health.
Abel says he is drinking more water but doesn't exercise much. The disease begins to take a toll on his emotional state. Well, one feels stressed and tired. For any reason, one gets mad. I tend to argue with everyone. It makes me feel sad. Abel Bravo isn't fighting this battle alone. Diabetes is the 6th leading cause of death in the U.S., and the number of new cases continues to rise for men and women of color. Experts say early detection is key. Symptoms include fatigue, weight loss, blurred vision, or numbness of the hands and feet. For more information about diabetes, visit the American Diabetes Association at diabetes.org. I'm Mark Daniil.